Testimony.
Thank you. Chair Colcourse and committee members, thank you for the opportunity to be here today. My name is Dr. Jennifer Kent, and I am the president of Victoria College. As a public community college committed to the goals of a talent-strong Texas, we recognize it is our role to provide solutions to the nursing shortage facing the state. At Victoria College, we have been working for years to provide the solutions to this very issue. Hopefully, our experience can be of value to others, and we view the legislature as a partner in addressing a recognized need. In terms of our successful outcomes, Victoria College students consistently achieve one of the highest passing rates on the NCLEX nurse licensing exam, surpassing the state and national average, and is regularly commended for our reputation as one of the top nursing programs in the state. I would credit that success in part to our decision to prioritize maintaining our full-time faculty positions, which are filled with quality professionals committed to high standards in nursing preparation. We've also been able to retain regional talent, which lifts our entire community. Even 10 years after graduating, 80% of our nursing graduates remain practicing in the Crossroads region, which means local jobs and local health care access. However, it is not as simple as just increasing our capacity to enroll more nursing students. Like the majority of other institutions that train registered nurses, Victoria College has an external constraint on the maximum number of students we can serve. That limit is based on the number of patients available for clinical instruction at hospitals, clinics, nursing homes, and schools across our 7-county service area. Victoria College successfully implemented simulation labs as a solution that was especially valuable at the onset of COVID when clinical sites were closed to nursing students. Our simulation lab space is equipped with modern technology and state-of-the-art instructional equipment and serves as a valuable instructional resource, not to replace hands-on training with patients, but to complement it. The ADN nursing program at Victoria College maintains a steady enrollment of students that is correlated to the number of patients within our service area. Annually, we graduate between 100 and 110 registered nurses. I commend the Texas Board of Nursing for maintaining high expectations and standards and for their approval of expanded simulation use. I am concerned, however, that the growth of for-profit nursing institutions from outside of Texas will needlessly impede the progress Victoria College and other community colleges and universities have made. For policymakers, I would say this concern is as important to note as our success and is the purpose of my testimony today. I was recently notified that Community Health Systems, CHS, the Tennessee-based parent company of 83 hospitals, 7 of which are located in Texas, has decided to partner with for-profit Jersey College, based in New Jersey. This Tennessee company plans to send Jersey College to the CHS-owned DeTar Hospital in Victoria to open a nursing program for 144 students. These students would then go on to staff CHS hospitals in Texas. Adding another nursing college will not yield more nurses. For each of the students that Jersey College admits, Victoria College will have to proportionally reduce the number of our students previously utilizing that precious clinical time slot. When I say our, I'm referring to the partnership that we have with the state, with the community as the trusting nursing provider since 1975.
So, Dr. Kent, your time is up, but I'm going to ask a question about that. We have discussed that today, and it appears that the nursing board would license that particular nursing school.
Yes.
Not the higher education coordinating board.
Correct. The process begins with a board of nursing. That's correct.
And so it is not an additional, like how many nurses are y'all registered nurses are y'all producing?
Between 100 and 110 per year.
So their 144 would not be in addition to?
No.
And their goal is to keep it within the CHA family versus, do y'all, I think there's another, I know there's another hospital or Citizens, along with other places that y'all are able to place registered nurses. So what impact would that have on the community?
This would have a terrible impact on the Victoria community as well as our region. Our county hospital, Citizens Hospital, would be negatively impacted, as well as our local university, who also has a Bachelor of Nursing program. This would definitely impact their ability to have clinical space.
So you have some of your ADNs move into the BSN role at University of Houston, Victoria.
Absolutely, and we encourage multiple entry points and multiple exit points. When a student leaves us, we encourage them to go on to the Bachelor of Nursing program. This would also impact our regional hospitals, our rural hospitals and clinics as well.
I'm sure y'all produce registered nurses that go on to like Lavaca Medical down there in the Crossroads region, or in Calhoun County, Port Lavaca as well, Jackson County.
That's correct.
I attended a roundtable last week where everyone in the LMHA was present, and so it's a pretty vast region. Do you have anything else to add today?
I just thank you for your time, and we are committed to affordable education for all of our students in the Crossroads.
So as the process moves forward, have y'all talked to CHA about your concerns?
We have begun our process with the local DHS hospital, which is DTAR.
Excellent. And do y'all do clinical rotations at Citizens as well?
Yes, absolutely. We are in every site that we are allowed in the entire 7-county service area. We have strong partnerships with every clinical site.
If you had more clinical sites, could you produce more nurses?
Yes. If there were additional patients, that is how we determine the number of students that we can have.
And as we discussed today, you as a community college determine how many clinical hours. You talked about simulation, but that balance between simulation, it can't be over 50%. So
Correct.
How many clinical hours do y'all require of your registered nurse?
The state sets a window, and we are about in the middle of that window, and it depends on the level. We have level 1 through level 4 students, and as they progress through the program, they're required to have more clinical hours.
Excellent.
So
Okay, thank you.
Level 1.
And we have discussed this situation, or I've brought it up several times today.
Thank you.
Are you seeing something that for-profit schools are now paying residents or clinical for clinical rotations? Have you seen any of that in the Crossroads region?
We have not seen that in the Crossroads, but we have heard of that occurring in the state.
Thank you. Members, any other questions? Thank you for being here today, and thank you for what you do at Victoria College and the important role we know our community colleges are filling for not just in allied health, but also in all our workforce needs. We appreciate you very much. I was going to ask you, how many first-generation students do y'all?
The majority of our students, over 50% of our students, are first generation, and the majority of them also grew up in deep generational poverty. We are the way out of poverty.
Excellent. And how much does it cost to get your registered nurse degree?
From beginning to end for the 2-year program, it's just between $12,000 and $13,000. Very affordable.
On this proposed new school that would take up the slots at DTAR, how much would that cost be? Have they advertised that yet?
When I went to the Jersey College website, their price is $47,000.
So not only would it impact, it would impact those first-generation students the most.
Absolutely, with a great deal of debt.
Thank you.
Thank
Senator
you,
Campbell.
Madam Chair. How many LVNs do you graduate per year?
We graduate between 80 and 90 LVN students per year. So for us, when students apply for the RN program and they're not qualified or they're not quite ready, we don't just let them go. We reroute them so they can start another entry point.
Great.
And then we bridge them later.
Okay. Thank you, Madam Chair. And we definitely need to work on out-of-state institutions that want to come through and with the scenario she just described, rather than having a Texas tried and true university. Turning out our students at a cheaper price.
Right.
And yet we know what the quality, that it's a good quality. So thank you.
Yeah.
Thank you, Madam.
Thank you, Dr. Campbell. You would know that very well, working in a rural hospital. You work both in a rural hospital, a suburban setting, and urban setting. So Appreciate that very much. Thank you for being here, Dr. Kent. Chair recognizes